Residents of Milwaukee County, county supervisors, elected officials, and others watching, it is an honor to present the 2022 State of the County Address. Once again, I'm thrilled to speak on the future of Milwaukee County and celebrate the victories and equity we've achieved together so far. Welcome and thank you for tuning in this afternoon. I'd like to begin by respectfully acknowledging where we reside here at the Milwaukee County Courthouse, on traditional Potawatomi, Ho-Chunk, and Menominee homeland, right on the southwest shore of Michigamme. Yesterday was the annual State of the Tribes Address, delivered by Shannon Hosley of the Stockbridge-Muncie Band of the Mohican Nation. She spoke of the many health and economic disparities still present among Native residents throughout Wisconsin. Those disparities are the result of generations of Native residents having been left out of the picture when we think about our progress in moving our state forward. And unfortunately, Milwaukee County history is no exception. But it is my hope that through our vision of Milwaukee County, we can repair the relationship with our Native residents, help tell the true story of our Native communities, and help produce a prosperity for future generations. Today, I'm proud to deliver the State of the County Address, because thanks to a strong vision for the future and a sound strategic plan to guide our work, the State of the County is stronger than any of us could have predicted when I was sworn in. Our team got to work just 2 months into the pandemic that threatened to have major and irreparable effects on our finances and our ability to deliver quality services. But thanks to the hard work from county employees, our partners throughout the county, and leaders at both the state and federal level, we avoided those threats and kept Milwaukee County strong through several changes in this pandemic landscape. And one of the major changes to the landscape was the emergence of the life-saving vaccines. Thanks to the help of the Milwaukee County's Office of Emergency Management, we were able to administer vaccines out of the Kosciuszko Community Center and successfully got over 17,000 shots into the arms of county residents. And we were able to prioritize the most vulnerable residents by building on our nationally recognized COVID-19 dashboard by developing the Evaluating Vulnerability and Equity Model, also known as EVE model, to dig deeper into the intersections of social vulnerability as indicators such as vaccination rates. And one idea that grew out of the EVE model and Esri's technology was the zip code program. In 2021, thanks to the cooperation of our partners at the state and municipal level, we opened up vaccine eligibility early to anyone 16 and older who resided in the 10 most vulnerable zip codes. The EVE model also allowed us to launch a free at-home vaccination program called Healthy Homes, which put more than 450 doses into the arms of residents in over 300 homes. Milwaukee County employees also did their part to stop the spread by getting vaccinated. More than 96% of employees subject to the vaccination requirement have submitted proof of vaccination. Thank you to the entire workforce of more than 4,000 Milwaukee County employees for your tireless service helping to navigate in these unprecedented times and keeping the public safe. Another change to the landscape that caught us all off guard across this nation was the emergence of both the Delta and Omicron variants just last year. And in response, our Department of Health and Human Services and our Office of Emergency Management has delivered nearly 500,000 masks to municipalities, community organizations, and general members of the public. The metrics on our nationally recognized COVID-19 dashboard indicates that thanks to masking and vaccines, we have moved past the Delta surge, and we're experiencing the decline of the Omicron wave right here locally. And while we hope this is a true turning point in our battle against COVID-19, we know that all along, we've been fighting not one, but two pandemics. By now, we are all familiar with the dramatic disparities highlighted by the pandemic, whether it was the early data showing disproportionate cases and deaths, or the difficulty people of color initially had accessing vaccines nationwide. Racial health disparities and barriers to preventative health care existed for people of color long before the pandemic. We have seen two destructive forces, COVID-19 and institutional racism, wreak havoc on our community each day this pandemic goes on. But this is one of the reasons why Milwaukee County has spent the last 2 years implementing our strategic plan to address the structural factors that allow racial health disparities to exist. We're addressing our policies and practices that have prioritized who gets what resources for generations. We've created 7 internal strategy teams to help advance the work of the 3 strategic focus areas of our strategic plan. That is creating intentional inclusion, bridging the gap, and investing in equity. Our diversity and inclusion team and equitable contracting team They have done crucial work to help make sure that county government reflects the full diversity of Milwaukee at every level. When we think about our service alignment team, they're bridging the gap on health disparities to determine what, where, and how services are delivered to advance equity. And those team members also inform decisions on where to make investments that tackle the root causes of health disparities. Or our integration team, who's working to maximize and the quality of services offered by the county by breaking down silos that have existed in government for far too long. And the racial equity lens team is ensuring that we apply a racial equity lens to all decisions we make. The fiscal health team, they're working to enhance the county's fiscal health and sustainability so we can continue to make investments in equity in our future. And the inclusive communities team, they're finding ways to dismantle barriers to diverse and inclusive communities that have made our community one of the most segregated in the nation. But in addition, this year, we have reorganized the county's budget office to include the county's strategy director. Now, it only makes sense that the county staff charged with passing responsible budgets is integrated with staff tasked with creating long-lasting change that dismantles inequitable systems and establishes new systems that meet the needs of all of our residents. This new department will ensure we prioritize our strategic vision when we make decisions at Milwaukee County, and that our strategy serves as a guide for everything that we do. And this full integration of the strategic plan into how county government operates is a major step forward in our effort to move resources upstream and bridge the gaps in health disparities that currently makes Milwaukee one of the least healthiest counties in the state. And although we may be turning the corner on COVID, we're just getting started on addressing the problems that have come generations before us. Because we know that without addressing those structural issues right now, we will continue to see widening racial health disparities long after this pandemic is behind us. And housing security is a critical social determinant of health. And I'm no stranger to the negative impacts that evictions can have on a family. Growing up, my family faced both evictions and housing insecurity long before the pandemic. And Black residents are more likely to face housing insecurity than their white counterparts. We've led the charge nationally in getting rental and mortgage assistance out to vulnerable households. In the last 2 years, we've invested more than $47 million into eviction prevention and mortgage assistance. Black residents made up more than 80% of those receiving assistance, highlighting the deep disparities that existed in housing security even before the pandemic. And earlier this month, we announced receiving an additional $50 million in funds through the U.S. Treasury Emergency Rental Assistance Program. And thanks to champions like Senator Baldwin and Congresswoman Moore advocating for Milwaukee County families, we are prepared to continue our rental assistance program that is making a difference in lives every single day. And we've expanded on this work with the creation of the Right to Counsel program, which was established last year. Right to Counsel provides free legal counsel to low-income families facing eviction, and it plays a critical role in keeping families in their homes. And in addition, the county's work with our partners to increase housing security led to a record low in Milwaukee's Continuum of Care's point-in-time count, which is an annual census of all of those experiencing homelessness who are in shelter or in unsheltered settings. Our team works each day on outreach with people experiencing homelessness, and they know that these aren't just numbers. These are real people who deserve a real shot at success. And you know, one of my favorite housing stories, success stories, is of a Milwaukee man in his 60s who was on the streets for 2 years in a row. Now, he initially was hesitant to accept services from our outreach team. And so our team checked in with him multiple times a week for close to a year. They kept in contact, they built a rapport, and they earned his trust. And the determination, the consistency, and creativity from our outreach services team allowed us to eventually work with him and aid him through the housing process. And today, after 2 years on the streets, he is approaching his 1-year anniversary of staying in his own new apartment. And because of this housing-first approach, coupled with housing-focused street outreach, he found stability and is permanently housed. It is because of the tenacity and determination of county staff, coupled with a strong emphasis on housing-focused homeless outreach, that the unsheltered population in Milwaukee County has decreased 90% since 2016, from 207 to just 17. But additionally, we've seen a 46% decrease in overall homelessness from 2015 to now. Housing first, as a philosophy, has also allowed our community to embrace the understanding of how important housing is to one's health and their stability. Increases in homeless outreach, eviction prevention, and permanent housing resources over the last few years have led to more housing and service opportunities for those experiencing homelessness in our own community. And when it comes to creating a healthy community, the importance of providing access to reliable, quality public transportation built on sound infrastructure cannot be understated. In 2018, the Milwaukee County Transit System started working on the MCTS Next. This is a new approach to improve the rider's experience and meet the community's modern needs. And MCTS completed all 3 phases of MCTS Next last year in order to improve the rider experience and meet the community's modern needs. The results is faster routes, more connections, and an easier system to navigate. In addition to improving the system, we're working to address the gaps in public transit that are preventing good, capable Milwaukee workers from accessing well-paying jobs in other parts of Milwaukee County and beyond. Earlier this year, Sewer Pack and UWM launched the FlexRide pilot program to break down the last-mile transportation barrier for residents living on the north and northwest sides of Milwaukee. And FlexRide's goal is to use technology to close Milwaukee's first and last-mile transit gaps. And closing transit gaps can expand access to transportation for local workers, ultimately fostering opportunities for economic mobility. This is a convenient and affordable transportation service that connects Milwaukee neighborhoods with businesses in the Menominee Falls and Butler area. And pickup points are connected near 5 MCTS bus stops. Residents can sign up for the service by visiting flexridemke.com or downloading the FlexRide Milwaukee app from their mobile app store, or you can call 414-667-7433 to get started and book your first ride. We also look forward to our continued progress on the 9-mile east-west bus rapid transit line. The BRT will better connect major employment, education, and recreational destinations through downtown Milwaukee, or Marquette University, Milwaukee's near west side, Wauwatosa, and the Milwaukee Regional Medical Center. A more connected county is also key for our immediate economic recovery. It makes it easier for some to spend dollars in every part of the county, and for others, it improves access to jobs or training and educational opportunities. You know, when I first took office, I made it a goal to move Milwaukee off the list of one of the most segregated communities in America. And we can't force our way off this list, but we can expand mobility throughout the county. And connecting people with the job opportunities that exist beyond their own neighborhoods is how we begin to reverse the history of segregated neighborhoods. And the bipartisan infrastructure bill that was passed last year supports our county's strategic plan by investing a historic amount in communities that have traditionally been underserved as well as left behind. There are a host of opportunities in this bill that our Milwaukee County Department of Transportation is exploring to reconnect communities divided by the physical barriers erected by racist transportation policies of our past. But in addition, we know that getting drivers to slow down and drive safely on our roads is a challenge. The infrastructure bill provides opportunities to partner with municipalities on remedies to slow traffic and reduce risky driving and improve safety on our streets. Federal aid has helped further strengthen the Milwaukee County transit system. But without more federal aid in the near future, MCTS faces a $40 million deficit that would need to be closed as soon as 2025. And this means that difficult decisions lie ahead if more federal aid doesn't find its way to Milwaukee County. And with a service as important as this one, we must put every option on the table to keep this key service running for our residents. Now, I'm a staunch believer and advocate for being aggressive and getting every single federal and state grant dollar that we can secure to fund ideas that improves access to and the quality of services for all of our county residents. In my first budget, we created the Grants and Special Projects Division to do exactly that. So far, we've seen a major return on our investments with the division staff of 3, having to secure 11 awards so far totaling $18 million, with 20 projects still pending notice of award. But in 2022, the division aims to secure at least $15 million more in competitive grant revenue to advance Milwaukee County's vision. However, this new division cannot be expected to solve our fiscal issues on its own. The financial challenges facing our communities are critical and have an adverse impact on our ability to invest in local priorities and restrain property tax growth. Over the last decade, due to a series of difficult state budgets and competing priorities, state aid to local governments have decreased while the cost of state-mandated services have grown. The funding imbalance means we've had to realize tremendous efficiencies, streamline services, and we've made government leaner, including through $30 million in annual budget cuts. Between 2010 and now, Milwaukee County closed a structural gap through nearly $400 million in expenditure reduction. But without a long-term solution to our funding challenges, by 2027, we will be unable to continue our current non-mandated services that we do offer, like our parks, our bus routes and emergency services, or arts and senior services, public safety, disability services, and youth services. And solving this problem by cutting is not possible, nor is it sustainable for us. We've cut to the bone, and we need to raise revenue if we're going to avoid a fiscal cliff in 2027, where we'll literally have no local funding for local services. And this includes transit, meaning all of our money will be going towards state-mandated services. But one sustainable long-term way to make an impact on our budget problems is to implement a local option sales tax increase. This increase will be used to both decrease property taxes and fund our local priorities. More than 30% of the state's economic output comes from Metro Milwaukee. And if we want to ensure Milwaukee County continues driving the economy of the region and to continue being a globally competitive region, we need the necessary tools to support the investments that will provide high-value jobs and offer a vibrant quality of life for all. A local option sales tax will capture the benefits of our own economic performance to invest in local priorities while providing property tax relief. But still, we are doing the most we can with the resources we have to meet the needs of every county residents. Overdoses, both fatal and non-fatal, climbed in the wake of the stresses of the pandemic. The number of overdose deaths rose 30% from 2019 to 2020. And so far, there have been more than 600 confirmed overdose deaths just last year. Milwaukee County, through the Medical Examiner's Office, was awarded a 3-year, $1.2 million grant from the U.S. Department of Justice to create a multi-agency overdose public health and safety team to examine near real-time data in an effort to develop and implement strategies for reducing the likelihood of future overdoses. In addition, grant funds have increased toxicology capacity at the Medical Examiner's Office, and we've added 2 new social workers. But in an effort to inform the public about the impact of overdoses, we have launched the Milwaukee County Overdose Dashboard. The dashboard serves as a resource for community members, organizations, and researchers working to reduce overdoses within the county, including the Milwaukee County Overdose Public Health and Safety Team. Understanding trends and differences between demographic groups across overdose events can aid in the development of data-driven interventions and prevention strategies to reduce overdoses. And of the residents who died from drug overdoses last year, fentanyl, either alone or in combination with other drugs, resulted in 79% of drug overdose deaths. Earlier this year, the State Assembly and Senate passed a bill decriminalizing fentanyl testing strips. And as Governor Evers signs the bill into law, Milwaukee County stands ready to distribute fentanyl testing strips and save lives. And mental health is a major concern for households all over the county, and I'm proud to say that a new community resource is slated to open up this year in the form of a mental health emergency center. The new mental health emergency center is a significant milestone in the work to address the mental health needs of the community. It will serve to bring health resources to parts of our community that have either been traditionally underserved or excluded. And too often, one of the largest barriers to receiving support is knowing where to go for help, which is why providing a center that offers easily accessible mental health specific services right in our community is so important. And I know firsthand what it feels like to see someone you love go through hard time and exhibit signs of crisis. I wish I would have known about the signs of crisis or had access to the resources nearby where I could get help. When I see the tragic headlines on the news of young lives being taken too soon, it is often accompanied with a description of unusual or inexplicable behaviors. And in those moments, I can't help but think that they would still be here with us today if someone close to them had the tools to identify a crisis or had the resources in their neighborhood to turn for help. The new emergency center will be located at 1525 North 12th Street, and it puts it in a neighborhood where more than 70% of the patients currently served by behavioral health services already live. And for nearly a decade, our behavioral health services have been transforming to become a practice model of care in partnership with advocates and consumers, health systems, community health centers, and other community-based organizations. Our goal is to vastly improve crisis services work to destigmatize mental health care, and offer easily accessible community-based services. And I'm happy to report that progress continues on the overall psychiatric crisis redesign to a system that is patient-centered, focused on recovery, and focused on the community. One of the community's newest programs, the Crisis Assessment Response Team, or CART, couples a trained clinician and a law enforcement to respond to emergency calls involving individuals experiencing a mental health crisis. Working side by side over the last year, they've helped connect people in crisis with the resources needed to remain in the community. And one wonderful example of why CART was formed is in a story from December of last year, where one of our OEM dispatchers, Brenda, took a call from a woman in distress at the lake who was intending to take her own life by jumping in the lake. And to make matters worse, she had a young daughter with her. Brenda spoke briefly with the mother, but the woman soon stopped talking and gave the phone to her 6-year-old daughter. Brenda was able to obtain the necessary information to locate the caller, while at the same time comforting the terrified child. And because of Brenda's compassion, empathy, and patience, it led the CART teams to locate that woman and ensure her daughter's safety. Success stories like this one is what our entire psychiatric crisis redesign is all about. To build on this success, the Department of Health and Human Services is taking a COG Center community survey as we begin to reimagine a human service campus on West Village Street. We know that households know best what problems they face each day and what relief they need to overcome those challenges. We want the community to have a voice in how human services are not only delivered, but how they're received. I believe our collective health and wellness is of the utmost importance as we navigate out of the pandemic. And that's why I'm inviting all Milwaukee County residents, our children, our parents, our grandparents, to join our Healthy County Initiative. So kicking off this spring on Saturday, April 2nd, the initiative will bring Milwaukee County residents outside and into our parks, our trails, nature areas, beaches, and countless other outdoor spaces to foster their physical and mental well-being. And I'll be honest, I will be personally lacing up my sneakers, my hiking boots, or cycling shoes, and will host you at a scheduled event in one of our Milwaukee County parks. Milwaukee County has established its vision that by achieving racial equity, we will become the healthiest county in the state of Wisconsin. And one way we are addressing these inequities is by ensuring equitable access to parks, trails, and outdoor spaces that support healthy lifestyles and athletic activities like running, walking, and cycling throughout the county with a focus on improving access in underserved areas. And now let's bring this vision to life and fill our parks with activity starting this spring. Now, I cannot address the state of Milwaukee County without addressing the very real problems of violence on our community streets. It is no secret that this is a very difficult time for our community. And in the first 2 months of this year, we've seen too much violence and too many children dying in our streets. The violence didn't happen overnight. This is the result of generations of disinvestments in communities of color. And this is why we believe reversing that trend and investing in Black and brown neighborhoods is vital for the health of Milwaukee County moving forward. Just last summer, we launched the Credible Messenger program to pair justice-involved youth with adults with similar experiences. And these adults serve as mentors for youth and are available to their mentees 24 hours a day. And they check in regularly and provide support where it's needed by connecting young people with resources and helping mediate disputes before they turn dangerous. And the mentors come from 5 different community organizations and programs: 414 Life, Running Rebels, Milwaukee Christian Center, the Youth Advocate Program, and West Care, Wisconsin. Now, there's an incredible story from September of last year that illustrates how important this program is for young people. Tensions were high between 2 groups of youth after the shooting death of 2 young men in 2020. And the tensions had the potential for violent retaliation between these 2 groups. But because of 414 Life's violence interrupters, they were able to connect both groups and prevent a retaliation shooting following those deaths. The multiple members of both groups were either incarcerated or passed away. And violence interrupters, they were successful in convincing these kids not to take that violent path. And now the plan with 414 Life, in collaboration with other partners and with the city, is to help these young people find housing, jobs, and counseling. And mentors check in with these young people daily to ensure that they don't choose a life of violence as a solution to their problems. There's a long road to go for these young people, but we've made the first critical steps in stopping day-to-day violence among these groups of teens. And even better, is knowing that we're continuing to work with these young people and connecting them to resources that they need to lead long, successful lives. Now, I've spent my life fighting for resources, fighting for equity, and fighting for neighborhoods most in need. And I believe we must come together, pull every single resource available to halt the violence and really heal Milwaukee. When I speak to residents around the county, they tell me that our young people, they don't have the same opportunities we did when we were growing up. The recreational leagues or the after-school programs, they aren't as abundant as they once were. And that is why I'm proud to announce that Milwaukee County is working to change that, and we declare 2022 the Year of the Youth. The Year of the Youth will be a unique partnership with the Milwaukee Downtown Bid number 21 and the City of Milwaukee to lift up young people and provide a wide range of activities and opportunities. We will connect young people to jobs, encourage their creative passions, and provide mentoring and job shadowing opportunities, shadowing youth days at sporting events, and publicly highlight the best in our young people across the community. The Year of the Youth programming will go a long way in setting the next generation up for success. However, the problem in our streets goes well beyond our young people. There are many people in the county with underserved or unaddressed mental health issues and behavioral health issues that have been ignored for too long. And the results of those needs are not being met. We're seeing it being played out in our streets. And starting next month, I will be holding a series of community health and healing conversations that focus on normalizing talks around mental wellness, increasing awareness of availability of resources, and eliminating barriers and connecting to services. So on March 10th, I will be joined by Dr. Kwaku Ramel-Smith at the first of these community conversations at the Wisconsin Black Historical Museum. We will be visiting neighborhoods where violence occurs and neighborhoods where some of the most highly vulnerable residents reside. We plan to bring our message and our resources right to the doorstep of the community. In the last 2 years, we've done great work to change lives, to change perspectives, and to change attitudes. And I'm proud of the change makers who work here at Milwaukee County, and I'm calling on the community to join us in our work. If you are passionate about improving mental health, if you want to help those with behavioral health issues, or if you desire to work with youth and show them their unlimited potential and power, then visit the Milwaukee County's Employment Opportunities page on jobs.milwaukeecounty.org to learn more and get connected. Even if you're not sure what you want to do, we currently have a wide range of careers at all levels in all departments, from parks and the zoo to clinician emergency services to the House of Corrections and Sheriff's Office. There are many opportunities to be a change maker right here at Milwaukee County. People passionate about making change are a precious resource. And in order to heal our community, we need you here at Milwaukee County being the change. We, Milwaukee County, we are a resilient community. Over the last years of this pandemic, we've rolled up our sleeves and did the job necessary to keep residents safe from the spread of the disease. Those early months taught us many lessons, including that the work is easiest when we share the load and come together in tough times. The moment we find ourselves in today, it's no exception. It's no exception. But I'm optimistic that we can come together once again to find and face all of our challenges and improve both the health and safety of all of the Milwaukee County residents as well as neighborhoods. So please, be safe, thank you, and God bless.